Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, since my hip surgery, I've been feeling a lot better, more mobile, but there's still this persistent issue with my urinary function. It's really frustrating. I've been using a catheter for relief because I can't seem to empty my bladder completely, and the flow is just too weak.
I understand that must be quite bothersome for you. Tell me a bit more about how often you're having to use the catheter.
Pretty much daily, especially in the evenings. It's like I can feel that not everything comes out, and then I have to use the catheter to avoid any discomfort overnight. I've been on Flomax for a while now, and you mentioned starting finasteride.
Yes, that's right. Finasteride can help reduce the size of the prostate over time, which might improve your symptoms. We'll discuss the benefits and any potential side effects later in our session.
I hope it helps. Also, my blood pressure has been a bit high lately. I've been monitoring it at home like we discussed last time. The readings were often around the 160s over 90. After resting it drops, but it still concerns me given my history with hydrochlorothiazide.
Good job on monitoring it. It's important we keep a close eye on that, especially with your previous experiences of low blood pressure. How about your recovery from the hip surgery? How are you managing with your daily activities?
It's going better than expected, actually. I'm walking around the house a lot more, sometimes even without any help. I'm still cautious, of course, but it feels good to be more independent. I do exercises at home that the physiotherapist showed me.
That's great to hear. Being active will definitely help your recovery. Have you noticed any other symptoms or concerns, perhaps related to the medications or otherwise?
Not really, aside from the issues with my prostate and blood pressure. Though, there is this one thing. I've been using a salve for a skin issue on my nose. It's been persistent, so I have an appointment with a dermatologist to check it out.
Good that you have that scheduled. Keeping up with all aspects of your health is crucial. Let's ensure you continue to monitor your urinary symptoms closely and report any changes, especially once you start on finasteride.
I will. I just want to make sure I'm doing everything right to manage these issues. It's a lot, between the prostate, my hip, and keeping track of my blood pressure.
Absolutely, it can be overwhelming, but you're handling it well. Let's go over your recent clinical measurements and lab results to give you a clearer picture of where things stand. Your blood pressure today, after resting, is 140/85 mmHg, which is better than when you first came in. Your weight is stable at 180 pounds, and your height remains at 5 feet 9 inches, giving you a BMI of 26.6, which is in the overweight category, but close to normal.
That's a relief to hear. I've been trying to watch my diet as well.
That's good. Your PSA level is at 0.8 nanomilliliter, which is quite low, suggesting that your prostate condition is currently managed well with medication. Your kidney function, with a creatinine level of 1.2 mg/dL and a BUN of 18 mg, is stable. Your complete blood count and liver function tests are also within normal limits. The X-ray of your right hip shows good alignment post-surgery with no complications, and your abdominal ultrasound showed a moderately enlarged prostate without significant obstruction.
That's a lot of information, but it's reassuring to know things are mostly stable.
Indeed, it is. Here's the plan moving forward. We'll start you on finasteride and monitor its effects on your prostate symptoms. We'll continue monitoring your blood pressure closely, especially to prevent episodes of hypotension. Keep up with your physical activities and follow up with your specialists as scheduled. I would like to see some blood tests done before our next appointment to ensure there are no adverse effects from the new medication.
Understood. I'll get those tests done and keep a close eye on everything until we meet again.
Perfect. I'll schedule a follow-up in 3 months, but please contact us if there are any concerns before then. It's important we manage these issues proactively.
Will do, Doctor. Thank you for clarifying everything today. It helps a lot.
You're welcome. Take care and see you next time.